temperature range of the red channel in the figure A, or the first row, the temperature range of the first channel is different for the left brace is different, or the intensity range of the first red channel of the benign left brace is different, or it's totally different from the temperature, like your intensity range of the right brace of the benign tumor. Similarly, for the bottom one, you can see the higher temperature, like higher intensity values are in the range of 200 to 250 in the bottom row for the left brace of a malignant patient. But the intensity value of, because this patient is having some tumor in her right breast, but in the right thermogram, the intensity range is from the high intensity ranges from 100 to 250 in the red channel. The intensity value of the left and the right brace in case of your benign and the malignant features, the statistical features like mean entropy, skewness, kurtosis, variance, standard deviation are extracted from different channels of the base thermogram, like the red channel, green channel, blue channel, and the red scale. And we have found that in the healthy base thermogram, you can see the range of the intensity values are 9 to 9.3. In difference between the left and the right, but in difference between the left and the right brace, the mean value is 25. So this changes in the value in the intensity scale also gives us some idea that there are some different, like there are some abnormality in the base thermogram. So that means helps us to quantify the difference between the left and the right features. But out of all these features, only the red mark features, which are the red mark, only those features I have used for classification purpose. Here I have used AI because AI to use it, we have represent the like difference in terms of like quantitatively, and that here done by using this statistical feature, by using the Mann-Whitney-Wilcoxon test. Once we have used that, now these features are used for classification tasks. Okay, now I have used the SVM classifier, the support vector machine classifier, because the support vector classifier is of it's a medical image processing. So that's why I have used SVM with different kernels, and out of different kernels, I found that the radial basis function kernel gives me the best result with the statistically significant temperature as well as intensity features. With all the features I have used, like the red channel features, gray channel features, blue channel features, gray channel features, all features I have applied on all the features I have applied yours SVM. But I found that only the statistically significant features can give you the highest accuracy of 83.22%. That means what? We should not go with all the features. After extracting all the features, we have to always check whether they are statistically significant or not. If they are statistically significant, then only we should feed them to the classifier. Because this statistically significant test will also always helps us to find out that which features are more discriminative than the other features. During the classification, my next task is to find out whether this like the location, because I just from the statistical test, from the intensity base, from the temperature profile base, I came to know that the thermography has a potential to be used in the breast cancer detection. But now my question is whether thermogram can locate the tumor region properly or whether it correlates the location with a mammogram. So to answer that question, I have just performed the tumor location matching. In tumor location matching, I try to divide the thermogram into upper left, your 4 quadrant. And then I have mentioned upper left, lower left, then upper right and lower right, like this, and perioral region. Then we have found that exactly in almost all the cases except one, you can see it is highlighted underscore as a 4, the patient ID 4. Otherwise, 4 and 8. In 2 cases, thermogram was not able to detect the your tumor, but otherwise in almost all the cases, thermogram, the location of the tumor in the thermogram is similar to the location of the tumor in the mammogram. That signifies that thermogram can be used as a base screening tool or non-invasive tool for those women for whom the mammography is not recommended. Next task was related to the identification of the discriminative features, statistical and geometric features. So for this is actually similar to my previous work. That's why I'm not going into detail. If you people are interested, then you can see this, go with this paper. I will just go with my second task, which is the singular value, use of singular value for breast abnormality detection. Okay, is it visible? That's slide number 27. Okay, fine. So next task is the singular value decomposition for breast abnormality detection. Now the question is, why I'm not going for, since most of the works are based on bilateral asymmetry analysis, then why I have proposed some other work here? Because I found that there are some cases in which both the breasts are suffering from tumor. In those cases, the bilateral asymmetry analysis fails. So, how to solve this problem? So we have to find out some way through which we can just extract the features from only the tumor region, not from the other region of the thermogram. So here, the key assumption to apply the singular value decomposition was the thermogram having the increased nipple temperature, hot patches, and vascularity are considered to be more suspicious and indicate more severe breast problems. So the abnormal thermogram possesses more higher temperature region than the normal thermogram. So based on the key idea, I have first performed the segmentation of the breast region because, as I have mentioned earlier, the underneath of the breast area is very much hotter than the normal breast region. Candidate thermal patches, I will just show you that what I'm calling the candidate thermal patches. Then from the candidate thermal patches, we just I have just extracted the singular values. Then this thing here, first I have used one semi-automatic segmentation method. So that gives us the help, that helps us to just extract the breast region from the necessary region of the breast thermogram, so that we can just find out the candidate thermal patches from the breast region only, not from underneath of the breast or the abdomen area. So first segmentation I have performed. After doing the segmentation, I have just to just have a better idea what I'm calling the thermal patches. You can see in the figure, second figure, the D correspond to the thermal patches which is present in the figure A. I'm just using the color white. But in the normal thermogram, you can see in the figure B, second figure, in the figure B, there's no abnormal or thermal patches, for which I'm not getting any thermal patches here. But again in the figure C, there are some thermal patches. We're going to extract these thermal patches, and from these thermal patches, we are trying to find out the. But now the question is, when I'm going to extract the singular values from the RGB channel, I found that, as you can see in the figure, RGB channel, there is no difference between the values, intensity values of the abnormal region as well as normal region. So I can perform a segmentation method here. Because two segments you have to have some certain intensity range, but here there is no certain range that this is belonging to the thermal patch. So what I have done, I have just converted the image from RGB to hue saturation channel, and I found that in the hue saturation value, the value channel is having a higher intensity value compared to the other channel. And this value, sorry, the saturation channel is giving a higher intensity value. And this saturation channel I'm going to use to segment the thermal patches. I have just converted my thermogram from RGB to hue saturation value channel. And I found that in the first figure A, it represents the hue channel. In the second figure, represents the saturation channel. And the figure C represents the value channel. So in this figure, it's clearly prominent the thermal, like you can see the patches, the thermal patches are clearly very prominent in the saturation channel. But in the image processing perspective, the white pixel represents higher intensity values and the black pixel represents low intensity values. But in thermogram, the white pixel represents hotter region and the black pixel, lower value pixels are represented by your cooler. So to maintain that quality or the same philosophy, we just convert taken the negative of the image, and we have seen in the D, we take the complement of the channel B, and where the thermal patches are prominent in the, you can see in the figure D, which is not prominent in the red, green, blue channel. So now from the original image, it's far better to identify where the tumor location is. We obtain your complemented saturation channel because we have applied the singular value decomposition. And after applying the singular value decomposition, you can see the magnitude of the singular values of the abnormal thermograms is having very high compared to the magnitude of the singular values in your normal thermograms. But this discriminative power gradually decreases if the rank of the singular value increases. You can see the ranks are 0, 5, 10, 15, 20. So I'm taking only 20 singular values, but we have more than 1,000 or the 500 singular values, but those are almost close to 0. So I have considered only 20 singular values for all the base thermograms, and we found that the magnitude is very high for the abnormal thermogram compared to the normal thermogram. Next task is to just find out that how many singular values I need to take. Because here I have taken 20. Should I go with all the 20 singular values, or I can take the less number of singular values? So for that, to analyze that, I take the help of AI. Use artificial intelligence algorithms, like different machine learning algorithms, 9 different machine learning algorithms, like k-nearest neighborhood, artificial neural network, random forest, or AdaBoost, all those. And I found that instead of 20 singular values, only 2 singular values are sufficient to classify the abnormal thermograms from the normal thermograms. Where in statistical or your intensity-based or your temperature-based analysis, I have taken 13 features. But here, only 2 features are sufficient to get the same amount of accuracy using the AI methods. Here, you can see there we have obtained only 83 or 82% of accuracy using 13 features, statistically significant intensity and temperature features. But here, by using only 2 features, I obtained the highest accuracy of 92.50%, 50% in my in-house data set, and I obtained the highest accuracy of 98%. Let me show 98% here in your publicly available dataset. So that means what? We just reduce the complexity of the system also. So this is the beauty of using singular values in breast abnormality detection from breast thermogram. Next, now question that started in my mind was that, can I design some index that will help me to just separate the thermograms in healthy, severely abnormal, or mild abnormal cases like benign? So then I have just found that I will use these 2 singular values of each thermogram, and I'll just find out their range. And I found that I have designed one breast abnormality grading index. by taking the help of only two singular values, and I found the normal people for a normal based thermogram, this base abnormality grading index, which is the summation of only the first singular value and the second singular value, is in the range of only 0.